we have a midline which goes right down the spine and over the head. I won't draw through your skin. And then we have a quarter one as well. And we basically have a midline that goes across, but actually if we look at the lymph system more closely on the back, we have, it goes more in that kind of pattern. Slightly different on the front, so we need to know what we're dealing with. But what we want to do really is clear up at the top before we start to work our way down the back. And there's different size heads, so depending on the size of the person that's laying on your couch, these two sizes are my most common ones, so the large one and the second large one. There's then the next size, and then there's what I call a digit one, so I would use that for toe or finger sort of swelling. I'm going to use the bigger piece on here on Adam. It's preset to 80 and it has a 2-second pulse interval. So we're just going to start up on the neck. We're working on this midline here. Now, some work was done several years ago with Professor Leduc in Belgium, who is a lymphologist, and he worked on cadavers that purely from a lymphatic perspective. And he was able to demonstrate that 3, definitely 5 movements proximal to the lymph system or that you're wanting to go to will have an effect of drainage. So I work on that principle that 3 to 5 movements in one position gives me a clearer mind that I've made a stimulation to the area that I'm working to. And we always kind of go proximal to distal. And that's not anatomically from a muscle point of view, it's head to toe. Are you impressed, physios, that a nurse knows that? I've had a big learning curve when it comes to other body parts. Are you alright, love?
Might fall asleep.
No, you won't. I don't shut up talking. Nobody is allowed to relax. So we're going down nice and slowly. Now you can say, oh, but you're not using your hands anymore. It's amazing how much you start to feel the tissue through this mouthpiece as you start to get used to using it. And actually you can start to feel whether there's tethering going on in areas fascially with patients. Whereas normally you'd be really deeping in with your hands. We still do that, and obviously it's 5 to 8, so I'm not going to start doing a full clinical examination on him. But here we're getting to the point now where we're getting a nice collection of lymph nodes. So what I want to start to do is really stimulate them, because we know the nodes are there, is giving it a slight twist and a slight pull. Okay. What I want you to do is look at these lines that I've drawn and how I'm moving the plane of tissue just ever so slightly. So that's that puddle and pond effect with the pebble, if you like. Now what we do is we go right down as far as we can, and then we go back up again, and then we will be working out at this point, well, we would have worked it out before now, which area is the problem and where we're going to be draining to. So I'm going to presume that Adam's got a right swollen arm. It always throws me when people turn over. That's your right arm, isn't it? So I'm going to imagine that this is the affected area. So we've opened this whole area up here, and we can spend 10 minutes just doing this, and it's actually quite nice because it relaxes your patients, it gets them used to it. Some patients can't lie in this position, or they're very uncomfortable, or if they've had a mastectomy they sometimes need a pillow to prop them up under that side to make themselves feel even uncomfortable. But what you can do is do this while somebody's sat up and leaning over. Certainly the gentleman who I've just been treating, who was palliative, he had bilateral lower leg edema and a huge amount of swelling in this sacral area. He wasn't able to lie on his tummy, only because he had all sorts of pipes coming out of him as well. We sat him nicely just leaning over the table to open all the back area and work on this lower area. I actually kinesiotaped him at that point as well, because the next job was to get his very heavy legs up onto the bed to then start doing the treatment with him sat upright. Not completely sat upright, squashing the groin nodes, but working in that area. And we're working up the sidelines here up to his axilla. So we were just bypassing the groin nodes the whole time and just going up into this area here. Very, very superficially. When we got to his knee, because his tissue was so fragile and it was about to burst with lymphorrhea, I used my hands because I really can absolutely control. I could have knocked this right down to 30, but his tissue needed the hands-on sort of approach with the MLD. So it's never ever going to replace my hands. The nice thing is it's a tool to help me do things that my hands can't do always, or have been able to do. So we're coming up to the midline here, and we've cleared that area. So now we've got two choices here. Because this quadrant here potentially is all affected, we've got this area here where we can drain into, or we've got this area here. We've got two adjacent areas. Now, depending on other medical conditions, age and type of venous disease or anything like that, we wouldn't necessarily want to go down to the groin if there were issues or evidence of that. We'd want to use the adjacent sort of axilla. So we put this right into the axilla area, and we can spend certainly more than 5. If we were doing MLD, we'd probably spend 10 movements in this area. It varies on which school you've been taught. The skin is thicker in the axilla than it is in other areas, so we need to make sure that things are cleared. So then what we're doing is we're clearing back towards that axilla, and we can do, I'm just going to speed it up a little bit, but we'll be doing 3 to 5 movements here, and we're clearing across here just as we would with our hands. So we're going all the way over, all the way over, all the way over, all the way over to here, and then we're coming back. And you can actually, if you just get a little bit of oil, sometimes just get that glide going back over, so you're getting that drainage back over into the axilla, and then you're doing again all the way over. So you, in essence, you're painting that area. You don't want any skin showing, you're clearing it, and then you're bringing it all back over. You can go down. The nice thing is there is a lymphotome and water that goes down the back part of the arm, and that's a beautiful position for somebody to be in for you to treat. If they were wearing an arm sleeve, they would have that on until that point, because the lymph system works better with some support compression, and neither would his arm be dangling down like that either, because we'd be trying to run uphill, so it would be supported upwards or on a chair at the side. So I then would take the arm sleeve off, and we would then clear this area here. But certainly I may, depending on how tethered we are, scar tissue wise, or what the rhomboids were doing, we'd be looking at all of that. We may well have upped the game at this point once we've cleared. So I will up the game just to show you what we can do. So we'll hike that up to 200. So you can hear the difference there. And we would be starting to make some movements as well in that area. Now if we wanted, and we will, because we can, we're going to add a vibration. It's nice, isn't it? You don't want anyone to stop when you forgot this. The sad thing is nobody ever does that to me. Don't worry about the redness, even with your lymphedema patients, because you would never stop at this point. We'd always effleurage back and drain. And when somebody has a lymphatic problem, you often get red hot spots where there's things sticking anyway, so, and it'll feel warm, it'll be a flush of skin, so you know you need to drain proximally to where that is and back, and eventually it'll clear off into that area. So I'll just put the vibration on to show you. So this is preset, I think, at 60, yep, right there. But you do lose a little bit of suction when the vibration goes on. So if you've not upped your game at this point, you would do. But I'll just take it down to a lower megahertz, and you can hear the difference there. Oops, no, that's the wrong way.
What do you think the difference is with the twisted on the skin?
You're getting more movement on a bigger plane, and actually I'm constantly kind of feeling tethering and movement and gliding with the tissues whilst I'm doing that. And actually what you want to start, if there's something really, if there's a scar there that's stuck like that lady's axilla, say if I couldn't pull it, I'd be working and counter-working on that to get that movement going. And then you can start to feel it almost melt underneath your hands. It's a very satisfying treatment, and it doesn't exhaust you as a therapist, which is a bonus. I know most of you are very young in the room, but you know, believe me, after 20 years you'll start to ache and pain a bit in a few years' time. But it's also about patient tolerability as well. Physios get a name for always hurting the patients, and it's no pain, no gain. Well, actually, it doesn't necessarily need to be that way. But what we want to do is actually get our patients to heal nicely themselves, really, and we can do it softer, a more gentle approach, nursey approach. Okay, so we would go up and down the limb, we'd go right down, and we'd follow all the pathways, and we'd drain, depending on where the blockage was. If it was an arm swelling, we'd be able to work that out from where the examination we would do clinically beforehand, and then bring up. If you're working on somebody that hasn't got a cancer diagnosis, hasn't got a problem with the lymph system, but has a pulled hamstring, and it's got swelling there, then you would start off doing this. You'd come all down here at 80, you work across the sacral areas, out and back in, out and back in again, and then you would be working down onto the IT band, working and clearing all that, because the lymph system tends to work out sort of laterally, working all your way down, and then you can go for it on your hamstrings as much as you want to. But then when you've then done all your high heavy work with your vibration and your high tensions, you then knock this back down to 80, and you drain all the way back up again. So you're bringing you clear the whole of the hamstring area all the way back up and all the way back up here, and you'd be concentrating quite a bit in these lymph nodes in this area, and then you'd be taking back up to here. Okay, now then you would then turn your patient over and do the clearance on the front, or you would work down the side depending on their problem and their ability. And when you are over the end, if you can just turn over for me, Adam, I just want to show, because I won't go in this area with in the jugular and carotid area. We would just use our hands normally, massaging that from a lymph point of view, because that's where the lymph drains down into there. But I do use this, and I feel quite confident to use this because of the tissue and the attachment of the muscles just below the clavicular line, and actually knowing that suction effect from how we work on our hands and that movement, I think is probably more effective than digging around in somebody's clavicle. I'm not sure what Ethelfoldy or Judith Caslisney or the Vodders would say if they were in here now.
What's your average treatment?
An hour for a lymphedema. For a couple of people in the village who've got an odd little tweak in the back or a little bit of a pulled muscle and just a niggle, then we're looking at half an hour. But for a lymphedema it would be an hour. But then if you're shifting 200 mils in an hour on a lymphedema, you're being far more effective than a lot of other treatments that are out there at the moment. So, okay, but there's a lot of nodes going on in the sternum, so you'd be working, but you would clear terminus, if you like, at this point here, just underneath the clavicular area. So the pathways, you've got to understand where they are, but basically you cut the body in four, you can't go wrong from a basic lymphedema drainage point of view if somebody hasn't got a lymphedema but they've got other problems. So you need to be thinking about incorporating your lymph system into, certainly for those of you that are in the sports world, because hopefully tonight you've realised it's got quite an important role in how the body heals itself and gets better quicker